Case 26, 2014. A 21-month-old boy with lethargy, respiratory distress, and abdominal distension. Definition. This child presented with lethargy, respiratory distress, tachycardia, abdominal distension, and elevated body temperature. The presence of an elevated anion gap metabolic acidosis quickly narrows the list of potential toxic exposures. Multiple toxins that cause an elevated anion gap metabolic acidosis can be responsible for changes in mental status, respiratory distress, and tachycardia, but only salicylate poisoning is independently capable of causing hyperthermia through the uncoupling of oxidative phosphorylation. In fact, hyperthermia is more common in fatal than in non-fatal salicylate poisoning, making elevated body temperature an important indicator of severe toxicity.
Hello, this is Dr. Carlo Oger, emergency physician and founder of edxitvideo.com. This video is about aspirin overdoses. An overdose of aspirin means that you've taken too much aspirin in your body. This can happen in two ways. If a person accidentally or intentionally takes a very large dose of aspirin at one time, it's called an acute overdose. If a normally daily dose of aspirin builds up in the body over time and causes symptoms, it's called a chronic overdose. This may happen if your kidneys do not work correctly or when you are very dehydrated. Chronic overdoses are usually seen in older patients during hot weather. Where is aspirin found? In Alka-Seltzer, Anacin, Bayer, Bufferin, Ecotrin, Excedrin, Fiorinol, Percodan, and oil of winter. Especially oil of winter contains large amounts of aspirin. Symptoms of acute overdose may include upset stomach, stomach pain, nausea, and vomiting, which may cause an ulcer or irritation of the stomach known as gastritis. Symptoms of chronic overdose may include fatigue, slight fever, confusion, collapse, rapid heartbeat, and uncontrollable rapid breathing.
Applications in medicine. The organ system most importantly affected by salicylate poisoning is the central nervous system. Neurotoxicity due to impaired ATP formation and possibly exacerbated by low glucose level in the cerebrospinal fluid may lead to agitation, combativeness, hallucinosis, lethargy, seizures, coma, cerebral edema, or death. In addition to its effect on the CNS, salicylate has a wide array of multisystemic toxic effects, some of which were observed in this patient. Salicylate stimulates the respiratory center in the brainstem, resulting in respiratory alkalosis. In conclusion, the patient in this case has an acute salicylate poisoning which caused the symptoms he had. The condition is called Reye syndrome, and if untreated, it could be lethal. Thanks.